Hippocrates, often referred to as the father of medicine, emerged during a time when superstition and divine intervention were the prevailing explanations for disease and healing. Born around 460 BC on the Greek island of Kos, his early life remains shrouded in mystery. However, the legacy he left behind would forever change the course of medicine, establishing it as a profession rooted in observation, study, and ethical practice. The island of Kos, a vibrant hub of trade and culture, exposed Hippocrates to a diverse array of ideas. This environment likely played a crucial role in shaping his inquisitive. Please subscribe my YouTube channel and press the bell icon for new update of mine. It is said that he was born into a family of physicians, part of the Asclepiadae, a guild tracing its origins to Asclepius, the god of healing. This lineage provided him access to knowledge and traditions that would serve as the foundation for his revolutionary ideas. As a young man, Hippocrates was reportedly trained in the traditional practices of his time, which combined rudimentary medical techniques with rituals and prayers aimed at appeasing the gods. Yet, even early in his career, he displayed a tendency to question these methods. Travel was an integral part of Hippocrates' journey. He ventured beyond the island of Kos, seeking knowledge and honing his skills. Accounts suggest that he visited Egypt, where he encountered advanced medical practices and the meticulous anatomical observations of their physicians. He may have also traveled to the Persian Empire, India, and other parts of the Mediterranean, absorbing diverse perspectives on health and healing. These experiences enriched his understanding of the human body and its ailments, laying the groundwork for his innovative approach. Hippocrates' greatest contribution to medicine was his rejection of supernatural explanations for disease. In an era dominated by belief in divine retribution and curses, he argued that illnesses had natural causes and could be understood through careful observation. This radical idea marked the beginning of his systematic approach to medicine. Hippocrates emphasized the importance of studying a patient's environment, lifestyle, and symptoms to diagnose and treat ailments. He believed that the human body had an innate ability to heal itself, and that the physician's role was to support this natural process rather than intervene with excessive force. Central to Hippocrates' philosophy was the concept of balance. He proposed that the body was governed by four humors: blood, phlegm, yellow bile, and black bile. Health, he argued, was the result of a harmonious balance among these humors, while disease arose from their imbalance. Though this theory has long been discredited, it was a revolutionary step toward understanding the complexities of the human body and its functions. It also underscored the importance of moderation in all aspects of life, a principle Hippocrates applied not only to medicine, but also to diet, exercise, and daily habits. The ethical framework Hippocrates established is perhaps his most enduring legacy. The Hippocratic Oath, though likely not authored entirely by him, reflects the principles he championed. This solemn pledge, taken by physicians to this day in various forms, emphasizes the importance of ethical conduct, patient confidentiality, and the commitment to do no harm. Hippocrates believed that medicine was a sacred trust between the physician and the patient, requiring not only technical skill, but also compassion, integrity, and respect for human life. Hippocrates' teachings were compiled into a collection known as the Hippocratic Corpus, a vast body of texts attributed to him and his followers. These works covered a wide range of topics, from anatomy and physiology to clinical observations and treatments. They provided detailed descriptions of diseases such as epilepsy, tuberculosis, and malaria, as well as practical advice on hygiene, diet, and surgical procedures. While some of the methods described in the corpus may seem primitive by modern standards, the emphasis on careful observation and systematic documentation was groundbreaking. One of Hippocrates' most notable achievements was his approach to diagnosing and treating patients. He stressed the importance of listening to the patient's account of their symptoms and observing their behavior, appearance, and surroundings. This holistic approach allowed him to identify patterns and correlations that others overlooked. For example, he recognized the link between environmental factors and certain illnesses, noting how climate, geography, and seasons influenced health. He also documented the progression of diseases, distinguishing between acute and chronic conditions and emphasizing the importance of prognosis in medical practice. Hippocrates' influence extended beyond his immediate circle of students and followers. His ideas spread throughout the ancient world, shaping the development of medicine in Greece and beyond. Roman physician Galen, who lived several centuries later, regarded Hippocrates as a foundational figure and built upon his teachings. Even in the Middle Ages, when much of classical knowledge was lost, Hippocrates' name remained synonymous with medical wisdom. His works were preserved and studied in the Islamic world, where scholars such as Avicenna and Rhazes incorporated his principles into their own medical treatises. Despite his towering legacy, Hippocrates was not without his detractors. Some criticized his reliance on observation and natural explanations, arguing that he undervalued the spiritual and mystical aspects of healing. Others questioned the effectiveness of his treatments, noting that many of the remedies described in the Hippocratic corpus were based on limited knowledge and could be ineffective or even harmful. Nevertheless, his commitment to inquiry, rationality, and ethical practice set a standard that continues to inspire medical professionals. The life of Hippocrates also reflects the challenges and rewards of pursuing knowledge in a world resistant to change. He lived during a time of great political and social upheaval when Greece was grappling with conflicts, both internal and external. Yet, he remained steadfast in his pursuit of understanding, believing that the study of medicine was not only a scientific endeavor, but also a moral duty. His dedication to his craft earned him widespread respect and became a symbol of wisdom and integrity. Hippocrates' final years were spent on Kos, where he continued to teach and practice medicine. It is said that he lived to an advanced age, a testament to his belief in the principles of moderation and balance. After his death, his reputation only grew, and he was revered as a near mythical figure. Temples and shrines were erected in his honor. His name became synonymous with the art and science of healing. The legacy of Hippocrates endures not only in the medical profession, but also in the broader context of human thought and culture. His emphasis on observation, logic, and ethics laid the groundwork for the scientific method, influencing disciplines far beyond medicine. His insistence on treating patients with compassion and dignity resonates with the core values of humanity. Hippocrates' story is a reminder of the power of curiosity, perseverance, and the relentless pursuit of truth. Today, as we face new challenges in healthcare and medicine, the spirit of Hippocrates continues to guide us. His vision of medicine as a noble and ethical profession remains as relevant as ever, inspiring generations of physicians to strive for excellence and compassion. Through his life and work, Hippocrates showed us that the true essence of medicine lies not in the tools or technologies we use, but in our commitment to understanding and caring for one another.